Dear colleagues, I'm happy to announce the ROTEM simulation workshops for 2021 organized by Werfen, Australia. What we know is that interpretation is still an important barrier for implementation of viscoelastic testing in emergencies such as trauma and obstetric hemorrhage. And as this study shows that even the fully automated systems like the TEXXS or the ROTEM Sigma have still the problem due to a lack of knowledge relating to interpretation, which hinders its impact on blood component management. And it's based on human nature that if you have the possibility to select a simple but wrong or a complex but right way for decision making, most people select the simple but wrong, like just using ratios of blood products for bleeding management rather than to decide for a goal-directed strategy. And this, again, results in difficulties in decision making, and the colleagues feel uncomfortable to do complex decisions. And therefore, it's very important to implement ROTEM guided algorithms because this allows even for the non-hemostasis expert to run a simple protocol with just yes or no questions and finally do the right decision. Also, simulation is very important because your simulation dummy might die, but your patient should not. So in particular, for situations which are not happening every day in your hospital, it's good to train by simulations. And here it's not only hemodynamics and ventilation, it's also hemostasis which matters. So the question has been asked and also addressed in clinical studies whether simulation really works. And this is a study from the trauma unit from Dallas in the US, where they were looking whether a monthly trauma simulation and procedural training were associated with improvements. And what they could show was that simulation training resulted in decreased time to interventions, which is very important in severely bleeding patients. And in particular, you need this training in cases of high acuity but low frequency. Whether this is also associated to short or long-term improvement in patient outcomes has to be addressed in future studies. But it's not only in trauma. As we see here, there's also a growing interest in simulation training also in postpartum hemorrhage, in particular for centers where severe bleeding is not their daily practice, or to train not so experienced colleagues like students or residents, but it's also part of a quality improvement projects, not only in the UK, also in other countries. And that means in such a situation, you have the choice to work with knowledge or with panic, or you can just open your fridge and give everything which is inside, or run or use a goal-directed approach and then provide the most specific therapy on the highest level of evidence. And again, this also applies for coagulation testing and coagulation management, and already several papers address this issue. And we also did, of course, in the past, not only like here in Brisbane, Australia, hands-on workshops within the simulation operation theater. You see here, that's a workshop from 3 years ago, where I think it's very realistic that you can do, for example, management of a postpartum hemorrhage here with modified or spiked blood samples, and then even allowing to do any potential therapeutic intervention in a real blood sample, just with the difference that we just work with 1/1000th of the blood volume. But of course, then, COVID-19 came, and this makes actually, of course, hands-on workshops impossible, but still we can do a lot of interactive interpretation workshops just online. And that's what we want to invite you to join us in our next year's ROTEM workshops, where we do simulations and interactive case discussions. We train you on using evidence-based ROTEM algorithms for a clear and structured decision-making, but an individualized therapy. We will use also cases like this with pre-recorded ROTEM cases. And finally, I think having this improvement in interpretation that allows really to bring increased safety to our bleeding patients, where we need 3 essential key points for success. One is a quick and precise point of care diagnostics, which we can provide with the ROTEM device. It's also important to have rapid, available, reproducible therapeutic interventions like factor concentrates. But again, maybe most important, we need reasonable algorithms with validated triggers and targeted values. And of course, clinicians educated that they can use this for a better bleeding management. So this is part of patient blood management, which has been recommended to implement from the WHO in 2010 on May 21, the birthday of my wife. And again, in this year, they inaugurated the World Patient Safety Day, which is now annually on September 17th. And again, I think this is what we want to achieve, the highest level of efficiency and safety in the treatment of our patients. And welcome again to the success, and enjoy the journey with us in our workshops for a ROTEM interpretation. Hope to see you soon in 2021.